This segment of Delmarva Life is brought to you by Delmarva Dental Services.
Okay, so let me ask you a question. How much time have you spent with your dentist that didn't involve you lying back in the chair as he or she checked you out, decked out in glasses and a mask? Yeah, me neither.
Well, if you think about it, you are putting a lot of faith into someone you probably wouldn't recognize out on the street. Well, Delmarva Dental Services in Salisbury approaches the dentist-patient relationship a little differently. It's a relationship where you and your dentist work together. The first time a patient walks through the door at Delmarva Dental Services in Salisbury, they can expect a bit of attention.
Initially, we find that people make the call to the dental office because something has happened. Sometimes it could be that they're new to the area, their dentist has retired, maybe they're just a few months overdue, but no major problems. But a lot of times there is something that prompts them to make that call, like a broken tooth or a painful tooth. Dr.
Leaki with Delmarva Dental Services says each patient has individual needs. That's why the first appointment is usually a comprehensive examination.
The comprehensive examination appointment is actually quite lengthy, about an hour to an hour and a half for the patient.
The first part of the appointment is spent gathering details, so the patient should expect to fill out a medical history,
including a list of their medications, past surgeries, anything that may be important to us.
Next, it's x-rays.
That is going to involve several x-rays inside the mouth and also typically the one Panorex, which goes around your mouth so we can look at your sinuses, jaws, everything like that too.
Following the x-rays, patients are asked to complete a questionnaire that covers everything from anxiety to dental habits.
How do they brush? How do they floss? Do they use a mouth rinse? What kind of diet are they typically on? That kind of thing, so that we can better get to know them.
Then it's time for more pictures.
And so they may be taken inside your mouth using a camera, and they may also be taken with a regular 35mm flash camera so that we can later show the patient, here's what I see, here's what you expressed to me your concern was, and here are our options for fixing it.
How are you today? Good. Good to see you. I'm good.
Once all of the information is gathered, a patient can expect a thorough one-on-one with the dentist. He or she will do an examination of the patient's mouth, looking for signs of TMJ or oral cancer, and also charting any previous dental work and evaluating the gum and bone around the teeth. From there, the doctor will review all of the information and come up with options for treatment.
So we really spend a lot of time here making sure that we devote the amount of time for that patient so we can give them their options on what treatments may be recommended, because sometimes there are more than one way to skin a cat. I mean, you don't have to do it it's only this or that, and that's it. So we like to be able to go over them, and big time we like to educate the patient. Make sure they understand that just because you don't see a problem clinically, that's what the photographs are for. We can say, okay, you don't see it, but here's the x-ray of that same tooth, and here's what we see.
Dr. Aki says this process helps to give the patient a feeling of ownership and responsibility toward their care. When they come back for their free consultation appointment, they will meet with their new dentist's treatment coordinator. In some cases, patients are shown an imaged photograph that shows them what options are available for replacing a tooth, performing cosmetic treatment, or changing old fillings or crowns.
It's a back and forth, allowing the patient to, one, understand the needs, and two, be able to make choices on what they feel is best for them.
Dr. Aki says the options may also come with different price points so that patients can factor affordability when making a decision. But in the end, Dr. Aki says it's the relationship between doctor and patient that is priceless. Now, many of the new patient forms, including the questionnaires you just heard about, can be found online and filled out prior to your first visit. You can find them and learn more about Delmarva Dental Services by going to our website, DelmarvaLife.com. Makes sense.
It's really amazing. Back and forth.
Yeah.
Interactive, involved.
Let's talk about this.
Love it. Yeah, love it.